Ash Lanori. Greetings travellers, this is Namo060 with you once again. It's been a long time coming, but I think it's finally time for me to express my opinions on why I oppose free market healthcare in a clear and concise video. I've talked about this in numerous comment sections, but often the subject and the discussion goes off on too many tangents, and I just keep getting lost in red herrings and numerous arguments which I can't address because I am not talking about this from an economic perspective. Because I do not understand economics, and so I do not want to go into something that I am not knowledgeable on. Now, before I continue, I want to get a couple of things out of the way. First of all, I do not oppose capitalist private businesses in general. I think that the private enterprise has a high chance of providing variety and innovation to the people that they serve. However, that being said, when profit is a motive, they will bend the rules and they will often try and find loopholes to make more money, as I will explain in a moment. I also want to point out that the systems like the NHS, the National Health Service of the UK, of which I am a resident, has been misrepresented numerous times. However, I will not be going into that in this video because it would take too long. Instead, I will link to an article on Wikipedia and any other sources that I can find that properly explain how the system works. It's not a perfect system, there are many problems with it, but I generally think that it works better than the private enterprise. But that is a discussion for another time. But anyway, what do I think the job of the state is? I think the main job of the state when big business is concerned should be to make sure that the customer is being treated fairly, as well as maintaining a specific standard of quality. My biggest concern with a free market when it comes to healthcare would be to end up like how private insurance companies in America today are operating. Even with regulations, they deny people with pre-existing conditions coverage, as well as making any excuse not to cover people. And with something like healthcare, it needs to be all-inclusive so that everyone can get the treatment they deserve, as with the tax-paid NHS system, without ever having the risk of going bankrupt because of it. And I think that taxes are a fair system and will not bankrupt people as long as the rates don't go more than the person's income, which they almost never are. This same attitude should apply to all big businesses. If you remove all enforced consequences, then why would you expect them to behave and not try and find loopholes in their own rules, or even make up their own rules to cheat people out of money? And when they can buy out smaller companies, and there's nothing to stop bigger companies buying out smaller companies and other bigger companies to make a gigantic super company, when there is nothing that prevents that from happening and no government or any sort of alternative, that's when things get bad. And that's when they can make money, continue making money, and continue to exploit people. That is what a free market will bring. Now, before anyone says, but don't you support the government having a monopoly on healthcare? No, I don't. I'm simply saying that if private businesses are to be in control and that they are going to make money and people are going to be having to pay out of pocket rather than through the tax system, then the government should be there in place to be making sure and putting regulations in there to make sure that the people are being treated fairly. And even with the current regulations, the weak source regulations as currently are in the US, I do not think that the customer is being treated entirely fairly. And with the current system in the UK, as I stated before, I will link to sources where you can get some basic information as to how the NHS works, but we do also have private companies which provide hospitals for non-essential treatment and insurance services, which you can make an appointment when it more suits you, again for non-emergency treatment. can get more choice of hospitals without the waiting time of the NHS. But even this is a tricky balance to maintain, and with the current Conservative government there has been some controversy with exactly how this is being handled and to what extent private businesses are taking hold of the NHS. But I will link to a source in the description box which gives you more information on that as well, just so that this video does not become convoluted. So all in all, if the government is currently sucking at regulating the big businesses who are in control of the healthcare of America, then at the very least they need to get better. They need to put their foot down and say, no, we're not going to babysit you anymore. We're not going to let you get away with anything. You need to follow this strict set of rules so that you treat your customers fairly. Because nobody in this world deserves to become bankrupt just for their own medical care. Even the most careful person in the world will get sick or get injured in accidents, not always their faults from time to time. And sometimes people are born with pre-existing conditions that they cannot help. And thus it is not fair on them and not fair on anybody for them to have to go bankrupt and no longer become a productive member of society just because they needed health care. Now, the last point I want to address is the notion that taxation is theft and that private independent charities can help to fund for people's healthcare. First of all, I do not see taxation as theft, as it basically is a fair system that means everyone gets a basic public level of treatment with only losing a small percentage of their income that they would anyway be paying for some kind of medical insurance. I don't see anyone besides the super duper rich, which I think is what the free market libertarians tend to be pandering to, would be wanting to pay thousands upon thousands of dollars each time they go for healthcare. And making it mandatory means there will always be enough money for people to be covered. This is something that needs to be available for every person on the planet. No matter what country you're in, no matter what your current financial state, you deserve to get treated. It should be a basic human right and not a luxury. Which leads me nicely onto the issue of charity. Don't get me wrong, I think charities are a wonderful thing. I just think that when this is something that needs to be nationwide and access to every public person, if you look at how much is taken through taxes and then you look at how much is just raised through the generosity of people, and I'm not saying everybody is greedy here, keep in mind, you will find that the numbers through taxes are far outweighed, because those who are not able to give directly give indirectly by earning a small portion less. On a side note, I just want to be clear on how much this small portion actually is. Currently, if I was to work £6 an hour for 40 hours a week, I would earn £220 a week. £20 of those £220 would go towards taxes, and that does not just benefit healthcare. But back to the main subject, just look at how much money was raised by all the people on YouTube from Médecins Sans Frontières or Doctors Without Borders, and look at how much money is going through other charities such as World Wildlife Fund for Nature or the Red Cross, for example. From my perspective, when a small amount of money is given to the government, they are far more trustworthy in regulating the spending on how much goes where. And when you have a democracy like most Western countries do, you have the power to get rid of particular politicians when they are obviously not spending the tax money correctly. If the NHS was in such a bad state and so much tax money was lining the pockets of David Cameron instead of going to fund the NHS, this is just a hypothetical situation by the way, then I don't think the people would stand for it. And so if someone like Nick Clegg actually stood up and did something about it and opposed this, then we could vote for the person who is going to be more fair instead. We can't do that with big business. With big business, it's all about who has the most money. Whoever has the most money has the most power. And if you put in a system which opens the floodgates to any and all businesses, good or bad, then you open a whole world of possibilities for big companies to cheat, lie and take your money without any repercussions or any consequences. Because if there are no fair options available to you and companies can do whatever they want, then it is you, the customer, who has tough luck and you lose out, not them. And thus that is why I oppose the free market, a completely free market, handling healthcare. Until the next time, Al Shalah. Safe travels.